So, welcome to this demonstration interview for A100 Medicine at Oxford.
Hi, my name is Michael Glitch. I'm a medical tutor at St Hilda's College.
And I'm Chris Norbury. I'm also a tutor and I'm at Queen's College. So, Maida, thanks very much for coming along to interview today. I thought we'd start by asking you to say something a little bit more about one of the things you mentioned in your personal statement. You did some volunteering at an Age UK discharge centre and you met a lot of dementia patients there. I know that was a little while ago now, but can you remember what sorts of things they were suffering from?
So a lot of the main kind of issues that patients had were generally they felt quite lonely, like aside from their physical health and things like that, but just kind of my role was more about chatting to them about how they feel and things. And quite a lot of the patients said they felt lonely and they felt like they didn't want to be a burden as well on people. Mm-hmm. And what other things were they saying? So they were saying that they felt kind of like lost as well through the whole situation. They couldn't really understand a lot of the medical jargon, and in terms of like their sons or daughters or family members sometimes weren't available for appointments, so it became quite difficult, and it just felt a bit of like a whirlwind, the whole experience. So I think those were like some of the like key issues that patients were
right, and they were preparing themselves or being prepared to be discharged from hospital. Is that right?
Yes.
So what sort of factors fed into that decision that led to them being judged ready for discharge from hospital?
So I think this was more. So we didn't really get to talk to the doctors as much, but kind of talking to the patients, they seemed quite well and they seemed quite aware of what was going on. They were quite aware that they were being discharged, and after talking to them quite a few times as well, they kind of knew what like papers they had to sign or what they had to read and what meds they needed to take. So I think it's just kind of that awareness, and also there not being any kind of like quite like a big risk to their health right now in terms of just like the surroundings or just themselves. So I think it was like obviously physically they seemed quite well, but also that awareness and a little bit of like the independence of like, yes, I know this is happening and I know that this is what I need to do following this.
And how did you feel about their readiness for being discharged? Did you feel they were ready to go back home?
I think for some patients they were quite excited to go back home. They just wanted like something a different environment. They wanted to be back to where they felt comfortable. So with talking to those patients, I felt like yes, a lot of them were ready to go home, but also for some of them I think they really were quite overwhelmed with the whole kind of moving out and having to kind of look after things yourself. So and also a lot of it was kind of a lot of patients didn't feel ready to go home themselves, but they were kind of like told by the doctors, yes, you are well enough to go there, I guess, to free up beds. So I think it's like for some patients they seem really happy to go home first. For some of them it might have been better to stay a bit longer, but obviously it's quite a difficult decision. Maybe kind of putting them in touch with like other charities or things that could help them would have been a better like getting their step to go home rather than straight away.
Thanks very much, that's great. Micah.
Okay, we're going to do the academic part of the interview now, and we're going to pretend that you're a student in my lab, and we want to develop a compound that we can inject into the bloodstream of the person, and the idea is that this compound will help us to determine the exact blood volume of the person that the person has. And so the idea is that we inject a known amount of this compound into the bloodstream, then after an appropriate period of time we take a blood sample, and then we can back calculate from the dilution of the compound in the blood the volume that the person has in terms of blood. We now have to design this compound that we're going to inject into the person's bloodstream, and I want you to brainstorm with me what kind of properties we would want this compound to have or to not have.
Okay, so this situation is you are injecting something into a patient and you're going to extract this, get the blood volume, and then measure how much the thing's being diluted, and then from there you're going to calculate the blood volume.
Correct.
Okay, great. So obviously this property will need to be unreactive and not react with things in the blood or not enter cells as well.
Okay, so what do you mean by not reactive? What are you worried about?
So maybe things like enzymes or like just stuff in like proteins in the blood, you don't want it to change their kind of structure, or you don't want it to kind of react with them and then not allow them things to react in their normal reactions.
Okay.
Like,
so what do you in particular, what would you be worried about? I mean, we want obviously the blood volume, but we would want the person to still be alive by the end of it. The person could just bleed them to death, right? We're not doing that. So what are you in particular worried about?
So maybe things like things that are needed in a respiration. So things like
very good.
glucose.
Good. Okay. So it shouldn't attach itself to.
Yeah, like free glucose in the blood and not like kind of prevent it going inside the cell.
Exactly. You said you don't want it to go inside the cell. Why not?
Because then, well, first of all, you wouldn't be able to measure properly how much is being diluted, and also you don't want it to react with stuff in the cell as well. Like it has like no kind of role in the cell, and it might alter things there.
Yeah, because the blood volume, we would lose information.
Yeah,
that wouldn't be good. What's the other thing? You mentioned respiration. We've touched on glucose. What's the other thing that it might interfere with?
Oxygen.
Yes.
Yes.
So we don't want it to do anything to that either. Yes.
Yeah.
Very good. What else? I mean, in terms of thinking, so anything that interferes with respiration, how else might our compound interfere with oxygen and glucose delivery to cells in a manner that is independent of it reacting with those two?
So like oxygen is delivered by like red blood cells. So maybe like disrupting the flow of blood cells, or like disrupting like maybe being like a barrier to normal blood flow. That would also affect glucose.
And how could a compound that you inject into the bloodstream interfere with blood flow?
So it might obstruct like vessels or something. Okay. It might not allow it might be too big, so the size.
Okay. So what is the maximum size that you would allow your compound to have?
I think
about like where it needs to go.
Okay. So the maximum size, I think it'd have to be smaller than the red blood cell.
Yeah. Why do you say that?
Because it has to go through like capillaries, and capillaries are like the size of a red blood cell. So it needs to be able to go through that. So it has to be very small and nothing like definitely smaller than the red blood cell. So that would probably be like the maximum size, probably even a bit smaller than that would be the maximum size.
Yeah, because they get squashed like the red blood cells. Yes, absolutely. Good. Do you think the compound could be too small?
Yes.
Why?
So in terms of capillaries have so you want this compound to stay in the blood.
Exactly.
So you don't want it to escape from capillaries, like in pores and stuff. So you need it to be very small, and you need it to be like the good size, but not small enough to escape.
Perfect. Good. There's another way how something that we inject into the bloodstream might interfere with blood flow. What else might it do? We've already mentioned red blood cells. Mm-hmm. Can you think of anything else? What other cell types do we have in the blood?
So you have white blood cells,
platelets, okay.
So what other way could it interfere with blood flow?
Think about what sometimes happens. People sometimes have issues. Right?
Oh, like clotting, maybe. Very
good. Yes. So which one would that be? Can you remember? GCSE.
What did you say? Sorry.
Can you remember from biology GCSE? Maybe. Which one of them is it?
Was it platelets do with clotting?
Yeah. Very good. Yeah. So if somehow the compound were to induce clotting of the blood, then that might not be terribly healthy. Okay, good. So we've talked about it not being able to interfere with respiration. It can't be too big. It can't be too small. We want to keep it in the blood. In which part of the blood? I mean, you've already said it shouldn't go to cells, so it should be in which part of the blood? What do we call the non-cell part of blood?
The plasma.
Plasma, exactly. What is plasma mainly made up of?
Water.
Okay. So what would your substance? What would you want it to be with respect to water?
So you wouldn't want it to dissolve. You wouldn't want it to dissolve in the water part, because otherwise that could affect maybe water potential.
Okay, you're touching on two things here. So if it didn't dissolve, would it be able to distribute evenly?
No. So I feel like you want some dissolve. You want it to dissolve, but you don't want it to affect water potential.
Okay, so these are two separate.
Okay.
we're treating them as two separate things.
Yeah.
And why mustn't it affect the water potential? You're absolutely right there.
Because then that will affect like water movement and potentially affect like the volume you're going to calculate.
Volume, exactly, which is the one thing we want to measure. So that's not good. Absolutely good. Now, one other way, so we've talked about it not essentially killing us by interfering with respiration, right? What else? I mean, we're not only concerned about killing people, we might also make people very ill. What might happen if you inject something into the bloodstream? What else might happen? We've mentioned red blood cells, platelets.
So you get like an immune reaction, maybe?
Yeah, exactly. Yeah.
So you don't want it to be like, you don't want it to trigger, like you don't want it to be like an antigen in the sense that it gets recognized by blood cells and like.
Very good, very nice. Okay, how about removal? So we've got it, you've said it's not too small, so it can't just disappear into the surrounding tissue. Would you want it then to remain in the body indefinitely?
No, you don't want to like just leave something there really. You kind of want it to get to kind of get rid of it. So I guess either by like naturally by the kidneys getting like filtering stuff out maybe.
At some point, yeah, or
like just being like metabolically like broken down.
Yeah, so if the kidney were to filter our substance out immediately, then we might just lose it straight away, right?
Okay.
So if it goes to the kidney, it would be gone. So we would probably want something that is metabolized and then the metabolites are removed. How long would you give our compound to remain in the bloodstream? What do you think is a sensible amount of time?
Half a day maybe?
Yeah, why'd you say that?
I feel like you want it to stay long enough so you can kind of obviously extract it and be able to, get kind of a sample and measure the blood volume and maybe a little bit of leeway if something goes wrong the first time, but you don't want it to stay for too long because obviously not having something like foreign in the blood probably isn't a good idea.
Excellent, very good. So let's now pretend we've found our super compound. We've tested it in animal models, works a treat. We're really, really pleased with it. We now have our first patient.
Okay.
And we're injecting 5 milligrams into this person. What do you know roughly how much liter of blood there is in a person, roughly?
I think off the top of my head, so could it be something like 10?
Yeah, it's a bit less.
A little bit less. 5?
Yeah, between 5 and 6 liters. Let's for ease of calculation, let's say 5 liters. Okay. So if we inject 5 milligrams into a person, and they have around 5, we estimate it'll be around 5 milliliters. 5 liters of blood. What kind of concentration would you expect to get out?
So is this in milligrams? Like, is the unit milligrams per liter?
You can do it in grams per liter, then go to milligrams.
Okay. So it would be the mass over the volume. So it'd just be 5 divided by 5, which would be 1 milligrams per liter.
1 milligram per liter, and that would be 1 microgram per milliliter.
Yeah.
Okay, good. So that's what we expect to happen. So we inject our compound, we wait an appropriate period of time, we take a blood sample, we label it, we send it to the labs. Half an hour later, we get a phone call, and the people tell us we have 50 micrograms per milliliter of our compound.
So it's quite a bit high.
That is very high. What happens?
So they could either be fault, like we maybe injected too much in.
Yeah, no, I wouldn't do that. No.
But
yeah, you're right. It could have been an issue, but let's pretend we can rule that.
So it's increased by quite a large amount. So I'm guessing it's not like to do with like the patient's blood volume being that out or something.
Unlikely though.
Yeah.
Shockingly.
Yeah. So maybe there's a problem in the kind of measuring how much is being diluted by. So maybe there was like an experimental issue. Okay.
Where might the issue lie? So we've taken the blood sample. I'm telling you, I'm perfect. It's no fault of mine. I'm deflecting the blame firmly somewhere else. So where might the fault lie?
Like with the lab that are analyzing this stuff.
Okay. What might have happened?
They could have like an equipment error or something, or like human error, something like that.
Yeah, absolutely. Yeah, good. I'm pretty much done. Thank you very much.
Okay, so thanks, Maida. We're going to have a question now that involves a little bit of role play. And in a moment, I'm going to share an image with you. And your task is really just in a short space of time, you have up to 2 minutes, to tell me as much as you can about what's in the picture. And the only obstacle that we're going to put in our way for the purposes of this role play is that we're going to pretend that I'm totally blind and that I have been since I was born. Okay, so do you understand?
Okay.
You understand the nature of the task, yeah?
Yeah. So I'm just kind of explaining this image to you, but you've been blind since birth.
Precisely, yeah. So I'm
Okay.
going to attempt to share the screen with you now. So I hope you can see the image, Mada.
Yep.
So your 2 minutes to tell me as much as you can about this image begin now.
Okay, so the image kind of centers on this large Ferris wheel, and the Ferris wheel is just kind of sitting on top of like a river or like a water, but it's very the center of the image. It's in a very kind of looks like a very big city. It's probably the London Eye type of images.
Fantastic.
Don't know if you're familiar with that.
Yeah. I know a little bit about the London Eye already.
Really?
So I understand that people travel sort of around on the outside of this thing in a sort of pod. Is that right?
Yes. So the pods are kind of all dotted like all around the Ferris wheel.
Right. Okay. And each of those pods is like a little walk-in room.
Yeah.
Right. Okay. Could you just very quickly, just tell me approximately how many of those pods there are on this Ferris wheel?
Oh God. Okay. So.
Just a rough.
So maybe
estimate.
like 30 or so.
Okay. Yeah. Right.
Kind of dotted around. There's quite a few. Maybe give or take a couple more, a couple less.
Yeah. Oh, that's nuts. So it obviously has a capacity for quite a large number of people.
Yeah.
And what sort of colour is it? I've always wondered what colour it would be.
So the actual circle itself is a very kind of bright white, and so is like the stand in the middle of the circle.
Mm-hmm.
But so there's like a bright white circumference, if you like to think about it like that, and then kind of the actual center part of the circle is just very transparent. There's just kind of structural like beams or wires there, so it's just like a white circumference, and then there's those black kind of pods dotted around the white circumference of the circle.
Right. And what can you see through the transparent part?
So you can see the sky, and the sky is very blue. It seems like very good weather in the picture. So it's kind of like a very nice picture.
I've often wondered what blue looks like. Could you describe blue for me?
Okay, so blue is kind of a more cooler color. So Are there any colors that you kind of are familiar with or something?
Well, I've read a lot about colours, but I've never seen them.
Okay, so blue it's a more of a cooler color,
Mm-hmm.
and it's kind of like, how do I describe blue? So yeah, it's a very cool color, and it's quite a lighter blue. So think of like a lighter kind of cooler shade. So nothing too kind of, how do I describe it? It's nothing very like fierce or kind of very shocking. It's very kind of a nice like paley cool shade, very kind of calm, and nothing that's very kind of in your face, like
Right.
something that's very striking. It's just very nice and calm.
Okay. And why do you think people travel on the London Eye?
So I think a lot of people go to the London Eye. I think the main thing would be the view, but obviously there's a lot of other things that come with the London Eye. It's quite kind of an iconic like tourist place, so a lot of people just go for the experience as like a tick off the bucket list. So there's quite a few different reasons people go.
Do you think I'd enjoy it?
Yeah, I think you would. Like I was saying, there's quite a few different reasons people go. It'd be nice to just have like a tick off, like, oh yeah, I've been on the London Eye. It's something to say you've done. And also kind of the whole atmosphere would be quite nice. And if you enjoy Ferris wheels, I don't know how much you enjoy them, but
I've never been on one.
okay. But if it might be something to kind of have like, it might be something to try and a nice experience. I think that there's a lot of other things besides the view to enjoy on the London Eye.
Okay.
Ferris wheels.
Well, I'll bear that in mind. I think I'll probably give it a go. Thanks very much, Maida. So I'll unshare that screen. And I just wanted to ask if there's anything that you'd like to ask us while you're here at interview that hasn't already been answered.
I think all the questions I've had have been answered really well. Thank you. So I'm good right now.
Okay, well, that brings our interview to a close. Thanks very much for coming along. We can now come out of character a little bit. And if anyone was feeling slightly intimidated by just how well Maida did in that demonstration interview, it's important that we point out that Maida has already been through this process and was successful and has already spent 2 years on the course. So you should bear that in mind when you're assessing Maida's performance here. But we think she did pretty well anyway, even taking those things into consideration. So thanks very much for that. And it's interesting just to reflect on how closely this interview resembled the actual interviews that you went through for admission to Oxford, Maida.
Yeah, I think they're very. It was very similar. It was the kind of structure of the interview was pretty much the same, as in you have like a little bit of a nicer question to start off with, and then you go into like the science, and then you go into a bit of a question that's kind of like, how do I explain what's going on? But the whole structure is the same, and kind of like it kind of flips between different interviewers. And yeah, I think it was the only thing I'd say is a bit different is that in the real interview you get like a piece of paper, so it's really helpful just to like write down your thoughts, and I found that really helpful for me, just writing out everything, what I was explaining and stuff. So that's the only real difference.
But I guess if we were doing interviews remotely, then candidates might take that advice. And how many interviews did you have while you were at Oxford for interview?
So I had 4 interviews that were all like kind of these style.
So same sort of style, but different questions, obviously.
Yeah.
Fantastic. Well, thanks very much for your time. And to all prospective applicants, I hope that'll be useful in preparing for your interviews. Thank you. Bye now.
Bye.
Bye.